Welcome, everyone, to the Autoimmune Hour. I'm Sharon Saylor from SharonSaylor.com, and you can find all of these posts and podcasts and videocasts over at understandingautoimmune.com. And as always, it's my honor and pleasure to be with you here on another brand new episode. I'm so excited because this is a topic that I really want to learn more and more about because I have found that I fall into this category. So I really want to learn more about it. And who better than to learn from Dr. Ann Hill? She's a specialist physician, and she just has a wide range of in depth knowledge about understanding people with really chronic and lots of different symptoms where a lot of people would have given up on us. But she is absolutely fabulous. And so today we're going to talk about mast cell activation syndrome, MCAS. And I know I'm a little worried about that because I hear people say, oh, isn't that sort of the disease du jour? But we're going to have Dr. Hill break it down and tell us it's a real thing. There's my wonderful friend Ann. Hi, Dr. Ann. How are you?
I'm great. How are you doing?
I'm great. I'm seeing it in the news everywhere. I saw your recent post on it. And what I loved about it, you break it down really clearly what mast cell activation syndrome is. Let's tell the audience, maybe they've heard it. I feel like we come up with these disease du jour. Like 20 years ago, everybody was talking about fibromyalgia, and I just want people to know that none of these are the disease du jour. It just happens to be the more and more science we get, the more we find out, right?
Absolutely. Mast cells are something that we're learning more and more about every single day and understanding how much they connect into so many different diseases, including chronic and acute pain, which I wrote my blog post on for last month that you're referring to. The mast cell activation syndrome is really only been named or around for really the last 10 to 12 years. And there is something called mastocytosis. And mastocytosis is similar and has very similar symptoms, but it's actually something that is considered a precancerous condition that's happening in the bone marrow where the body makes too many mast cells. But in mast cell activation syndrome, there isn't an issue with the bone marrow per se. But what's happening is we're realizing that a lot of people have an increase in their activity in mast cells. And mast cells are everywhere. They're all throughout our connective tissue, they're around our organs, they're in our brains. And what they do is they explode and they secrete histamine.
They
Histamine-
explode. So I wanted to
Yeah.
talk about this exploding. You said that word and caught me. Can we just take a little left-hand turn and
Yeah.
describe what you mean by they explode?
So the thing that I find fascinating about mast cells is they're a very essential part of our immune system. So when we
Okay.
have something happen, we need to get workers there really quickly to deal with that. Say we cut our hand with a knife, like when we're cutting our vegetables for dinner. And so the body needs to basically be able to get white blood cells and inflammatory mediators and things that are going to help and clotting factors and things like that are going to help fight the infection, assess the scene. So mast cells are like our 911. And a lot of them are already sitting there in the tissue waiting for things to happen. And so they have, when you actually look at them under a microscope, they actually have all these little bubbles inside the mast cell. They're called granules, and all of these granules contain different sorts of chemical mediators and immune mediators in the body. So when there's a trigger, which it does get triggered, and we think there's a huge connection between the nervous system, because the nerves are what's alerting us and saying, "Oh my god, there's something going on," and sending all those signals to the brain. And then it's sending the signals back down to the mast cells and saying, "Get there quickly." And so the way to do that is really to have they actually technically they call it degranulation. So the mast cells release all of these mediators and all the granules pop open with these different mediators to start assessing the scene and helping out with different things that might need to happen.
Oh, okay, thank you. This idea of
Explode is maybe not the medical term, but it's kind of what happens.
I got this visualization of this big, you know, maybe fire truck or something, and that pulls up and all these little things are jumping out to do their different things, like to quench the fire, whether they're hooking up the hoses or doing something else. This sounds like it's a very vital part of the body function that we need to be very careful with how we maintain it and optimize it.
Correct. It's something that is absolutely necessary for us to survive. It's a huge part of our immune system. But what's happening when people have mast cell activation syndrome is we're still trying to figure out all the different reasons, and realistically, it's probably that there's many different reasons that can be happening or making this happen. But with mast cell activation syndrome, we start collecting more mast cells, and different people will have more mast cells in different tissues. And then we have more mast cell activation, so we have more degranulation of mast cells, which means we have an increase in histamines, tryptases, things that break proteins down and connective tissues down in our system. And it's not necessarily an emergency, but we know that it's probably being triggered by something. And that's oftentimes what I'm trying to figure out in my practice when people come see me is when we figure out that mast cells are at play, we have to figure out why is this happening for them? Why are they having this constant trigger, which is very annoying. And there's a lot of symptoms that are not very specific for anything. So that's why a lot of these people are sent away by their doctors because they're like, I don't know what's going on.
So blood work is typically normal, but what are some common symptoms that you see that the protocol seems to help?
So a lot of symptoms that I'll see are I will see a lot of brain fog, which any of you who have allergies and know when you have allergy season, you know that your brain will start getting foggy until you might take your antihistamines.
A lot of us who experience COVID can relate to brain fog as well. Yeah.
Absolutely. Yeah, and we know with COVID and long hauler COVID that there is absolutely a huge mast cell connection. And not everybody is writing about that. There's only like a few published papers at this point. But all the doctors like myself who had already been treating mast cell were like, oh, this is what's going on. The mast cells are freaking out about COVID. So we're able to get people on things pretty quickly that were able to help some of those long hauler symptoms. So brain fog is one, massive amounts of fatigue. You have to think about like when you have a lot of histamine, when you have your allergies or long COVID, there's a lot of fatigue. And that can be just from the body having to process all that histamine and all those chemical mediators. There's can be lots of pain. There's usually some kind of histamine or mast cell component to chronic pain and acute pain. There can be issues with flares around sensitivities to the environment, like having a lot of pain, like when the barometric pressure is changing and things like that. The mast cells all respond to that. And actually, there's mast cell receptors on all of our hormones. So a lot of women will notice a flare in symptoms around their menses, either like right before their menses or during their menses. A lot of the patients that I have also notice that they just become more reactive in general to their environment. Like they might become more chemical sensitive, or they might become more sensitive perfumes or like newspaper print or things like that in their environment and have like more actually just like acute allergic reactions. And I want to point out too that on the mental emotional level, what happens with a lot of people is they get a lot of anxiety because histamine in the brain basically makes our brains and our bodies feel extremely anxious. So, what I like to tell my patients is that some of that could be from stuff that's going on in your life, but some of that really might just be from an increase in histamine. And we need to get those mast cells under control and help to stop that release of histamine for them to be able to relax and calm down and not feel so anxiety ridden.
As you went through that list, and I really resonated with several of them, I was like, wow, I could see where if I went to a medical professional that wasn't up to date with the latest understanding of mast cell activation syndrome, it could be any number of things. You
Correct.
could be sent to multiple different specialists as well. What kind of questions should you ask a physician? Is there a medical, like a blood test? Is there a test you can take for it?
The mast cells live inside the connective tissue in our body. The testing that we do is mainly blood tests. So we're not routinely taking biopsies of tissue, right? What are the things that are in that blood? So there are definitely a number of mast cell mediators or things that we know that are in the mast cells that we can test. One of those is histamine itself. Tryptase is another one. There's a whole list of things. But all of these mediators basically break down and are taken care of by the body really quickly. So unless you are actually in a mast cell flare, which a lot of people know is like intense itching, that anxiety, heart pounding, turning red, like dermatological things. I, a lot of people know who've had a mast cell flare know when they've had a flare, it randomly comes on. Sometimes it can even feel like a panic attack. So unless you're in one of those flares, we're not going to tend to get positive blood work for that patient. And that is really the problem. There's a lot of patients actually who have gastrointestinal disorders, irritable bowel syndrome, SIBO, things like that actually have an increase in mast cells in their gastrointestinal tract. And so there is one test that a lot of times, if we know that we're sending people to gastroenterologists, we always ask them to do, and that is called a CD117 stain. And that's where they take a biopsy and they actually put a special stain that highlights mast cells under the microscope. And so then the doctors or the pathologist can actually count the number of mast cells. And if it's over 20, I think is where they consider it like that you have too many mast cells in the tissue. That's almost the only really clear test that we have right now. And that's obviously not, I'm not going to send all my patients there to do that.
That's
If I happen to have patients that I'm sending to the gastroenterologist for different workups and things like that, I will oftentimes request that if I do believe that some of their gastrointestinal issues are due to mast cells and an increase in mast cells.
wow. This sounds very like a lot of autoimmune conditions. I know this isn't specifically an autoimmune condition, but just comparing it to autoimmune conditions, a game of elimination in a way. I know when I was first diagnosed with the original diagnosis of my autoimmune condition, there had been a few years leading up to that of it could be, or it could be, or it could be, until we were actually able to put a label on it. This sounds
Mhm.
like it's probably a similar type of situation that you're playing a game of elimination until you come up with the right solution.
Exactly. Absolutely. We want to make sure that there isn't anything more going on. And so it is really good to get those appropriate workups with the physicians. However, what I will say is by the time people are coming into my office, because I'm known for treating mystery illnesses, which
Yes,
mast cell
you are.
activation is. By the time people are coming into my office, they're super frustrated because everybody's just runs their blood work and their blood work looks totally normal. And the doctors either try to diagnose them with a mental emotional illness and say you need to be on go see a psychotherapist, or they just, I don't know, I can't find anything. So go away. And this is unfortunate because a lot of people know that there's something going on. They can feel it. They're having these episodes. So it's a tough situation right now. A lot of doctors still aren't totally aware of this. I actually think it's increasing in our society that more people are getting this.
In a weird kind of way, yes, I've said this before on the show, I'm somewhat thankful for the pandemic because it's brought a lot of the invisible illnesses to the forefront of our discussion finally. For
Exactly.
too often, many people with autoimmune and other invisible illnesses were, "You look fine," and they knew deep in within them that this wasn't psychosomatic. I want to mention that I am being treated for mast cell activation syndrome, and I'm on the right treatment plan. I found that I was like, wow, that was just a moment of relief when someone finally verifies your sanity.
Mhm. Yeah, I have a lot of patients expressing a lot of emotions in my office just because they're able to finally understand, oh, I'm not. Everybody's telling me I was crazy and I know I'm not. That's really important.
Let's talk a little bit about that part, though. You had mentioned it early in the beginning, somewhat in passing, about the nervous system and mast cell activation. And the things like anxiety from the outside can look like maybe they do need therapy. But how does the nervous system play into this? And would things like stress reducing types of practices help mast cell activation?
They definitely can. In fact, we do recommend that with a lot of our patients. Typically, what I wanna do is I wanna make sure that we're giving things to help support the mast cells so that we're getting them out of these flare states so that they're more stable. But honestly, I think a lot of patients do get a sort of post-traumatic stress from having mast cell activation because it's literally like something that is overwhelms their body and they can't control it. And it feels like I said, if anybody's had a panic attack, it literally feels like a panic attack for most patients, and it's that loss of control, and it's so difficult. So a lot of times when we can get the physical body under control and have symptoms calm down and have people more stabilized, then what a lot of my patients will say is when they get even the tiniest like little thing wrong, or something's off, they'll automatically jump to, "Oh my god, I'm getting sick. Getting sick again. I'm going down."
I don't think that's just true for mast cell. Any autoimmune or any of those other things is, "Oh, no,
Yeah.
no. Here we go
Yeah,
again."
absolutely. And so a lot of the brain retraining stuff we use for a lot of these illnesses, right? So when you get into that state where you know you're safe and stable in your, your mind and your body, but then there's still a piece of your mind that's, but maybe I'm not, and maybe it's gonna go downhill again really quickly. That's when it's time to start looking at some of these brain retraining programs. There's a bunch of different ones coming out, and literally it's basically like us trying to retrain how our brain is wired. So that wire or that train track that tells us, "Oh my god, I'm gonna get sick again." We want to rewire that so that our body doesn't, like, instantaneously go there. Because 'cause we're humans, we're gonna have illnesses, it just happens, and we don't wanna have to add to that or have our brains, like, instantaneously go down that track if we don't need to.
Dr. Hill is great at understanding chronic infectious diseases and understanding everything from viral to tick-borne to environmental illness. I just adore her because she is so open about, "Hmm, that's a good mystery, let's solve it." So, Dr. Hill, we've been talking about mast cell activation syndrome, and just wanted to have you on as an expert in the field for people to understand because I worry that people are going to talk about it as the disease du jour and it will be shuffled off to the side. I'm so thrilled that you're giving the science behind that it's an actual thing and it really does affect a lot of people's lives. We're talking somewhat about the nervous system and the brain part of it, but in your blog post for January, you talked about chronic pain and understanding how mast cell plays into that. If we have chronic pain, and what was interesting to me about your blog post, it said it wasn't like didn't have to be consistent or I'm sure it didn't have to be constant chronic pain. It could pain that sort of comes and goes or moves about the body, which sounds even more perplexing.
Correct, yeah. I wanted to make sure to write about that because I think a lot of people think of chronic pain as being something every day, all day long, but it's not necessarily, for sure. If you're having episodes that come and go and flare, then that is definitely a chronic pain situation.
How can you tell the difference? Is there something with I should talk to my physician about? And maybe I have an old injury, so it makes sense that maybe, okay, maybe that's my weak spot. Or how do I tell the difference between something I've done that maybe elicited that place to be painful versus the mast cells are playing a part in the pain?
That's a really great question. And I want to come back to what you are saying. You don't want it to be named the disease du jour, or we want to try to break that myth.
Yeah.
I've had to ask myself over and over again as a physician, am I prescribing mast cell stabilizers to too many people? What's going on? Why am I connecting these dots, or why am I seeing this? Am I wrong? But then people are getting better. So then I'm like, okay, this is helping. So a lot of times with chronic pain, one of my favorite doctors that I've listened to on a lot of podcasts, he's a pain doctor on the East Coast. He treats lots of patients with mast cell activation and dysautonomia and Ehlers-Danlos syndrome. Um, and his name is Pradeep Chopra. I always remember learning from him that when you're thinking about pain, you think about pain, but you can't just think, okay, here's the pain and here's the band-aid and it's going to go away. People who are in chronic pain, you have to think about treating them in terms of percentages. You might want to give something that's going to help with neurological pain. So that's a medication. And so maybe that's going to be 10% of their pain. That's going to take care of 10% of it. And then maybe you're going to want them to do some Feldenkrais classes to help with body posture and how their proprioceptive system is working. And that might be another 10% of it. And maybe you want to send them to go get some acupuncture or some physical therapy, and that's going to take care of another 10% of it. So, really, with chronic pain, we want to think about it's oftentimes multifactorial. We don't have a lot of great answers for chronic pain. Unfortunately, not a lot of great medications other than medications that we know people can become highly addictive to. So, we don't really want to send them down that pathway. In terms of histamine and mast cells, I know some people when I talk to them, I know some people have environmental illness that are probably driving histamine in their body and creating more of that mast cell activation. I know some people have had injuries, so there might be things that we want to work on. Like I said, sending people to PT or acupuncture, things like that. So these are all things that you have to put together to help people with chronic pain. And I don't think we always know. There's no good test to say some of it's histamine, but my testing is actually to put people on a mast cell stabilizer, especially if I feel like they might have more of a propensity, if they've had a history of asthma, if they have hypermobility or Ehlers-Danlos syndrome. I know it's almost built into the genetics for people who have that. So we really just do a trial of a couple of the different mast cell stabilizers, which I feel really comfortable doing because they're actually very safe. There's not a lot of side effects to the mast cell stabilizers that we use. Or sometimes we'll do a trial with like histamine type blocking medications. And that's a really safe, easy thing to do because we don't really have another way to figure it out. We don't have a specialized test to know how much of it is due to histamine release.
That's the fascinating thing about our bodies is each one of us is so individualized. I admire your skill, Dr. Hill, in taking the time to unravel this. It just seems to me when I think about all of this, all these different opportunities for these mast cells to come into play, how confusing it can get for
Yeah.
not just ourselves, but our medical professionals. Now, I had a quick question. A couple of things you mentioned was environmental, and we did talk a little bit about some of that, but can things like specific foods or molds or things like that activate mast cell activation?
Actually, mold is how I got into understanding about mast cell activation. I'm in the Pacific Northwest in Portland, Oregon, and we have lots of rain and lots of flooding and even leaf mold. I remember living in the Midwest and in Chicago, and they would clean the streets every week. We don't really clean our streets here. So we have pileups of like leaves still from the fall that start molding. I mean, that's just the natural part of life. And a lot of my patients, when they walk in it, they'll have they'll have lots of reactions to that. I treat a lot of patients who have what we call mold illness, which is where they tend to have mold in their environment, either in their car or their house or their work environment. We know that they're extremely hazardous to human health. In terms of the environmental piece, the thing that's interesting to me too about mold and mycotoxins, or mycotoxins in particular, and there's mold, and that's like what you can see, but mold secretes something called mycotoxins. And these are chemical mediators that come out of the mold and that can get into our bodies. And I always tell patients that mold and mycotoxins are a little bit like heavy metals. So when we have an exposure to heavy metals, we know that the body cannot really process those very well. We actually have to give something like a chelator to pull the heavy metals out of the body. And molds and mycotoxins are very similar. We need to give things to actually help pull those out of the body. But in the meantime, they love to hang out in a lot of our mucosal membranes, in our lungs, in our gastrointestinal tract, in our urinary tract. A lot of my patients with chronic mold illness have incontinence or have symptoms like that, and nobody else can figure out what's going on with them, but it's mold. So essentially with that, these are all tissues. These are all connective tissues. And guess what else is there? Is our nerves and our mast cells. And they know because the nervous system is telling the mast cells and the mast cells are agreeing with the nervous system. These are things that should not be here. These are things that are potentially dangerous. And so they need to try to do what they can to alert us and to try to get rid of them. However, it's difficult to get rid of them. So then when you get into this sort of more mast cells go to that area where there might be mold hanging out or mycotoxins hanging out, and then it just becomes a stone rolling down a hill gathering moss on it. It just becomes a much larger thing than it was originally. Yes, a lot of my patients have mycotoxin illness or mold illness and have mast cell.
Are those 2 treated differently? Is it like one treatment for, I imagine you have to clear your environment as well, but once
Yeah.
you discover that there's mycotoxin exposure, is that treated differently than mast cell? Do you do it in tandem?
So the other thing is when I get mold patients who had failed treatment, it's typically because the mast cells are so hyper responsive that they actually can't take anything. I have some patients that come in and they're like, I can only eat 3 foods. It was like in the New York Times or something where a woman was like allergic to her husband. I was like, okay, that's pretty bad mast cell activation syndrome. We all secrete sweat so it could be, to me, it makes sense, but it probably sounded completely crazy to the people who were reading the article. But I was like, yeah. I had one patient who was even had told me this was before I was treating her, but she ended up in the ER and they were like, they had no idea what was going on with her. And she got really sick from drinking water. So they wrote down allergy to water. We were like, laughing about that. It's like, okay. So,
I just wanna take a left turn about this because I was thinking about a friend who this was years ago, but I can't remember why, but was taking these garlic supplements, and I think they, probably were doing it off dosage, off recommendation. Because about 3 weeks later, all of a sudden, all of us are going, "Hey, dude, you smell like garlic." From
yeah.
10 miles away. "We smelled you coming, dude." So I
uh,
guess it wouldn't be exactly allergic to her husband, but maybe there's something like that going on.
yes. Yeah. That was my thought process too. So we want to treat mold we want to actually help get mold out of the system because by the time you're that sick that your mast cells are reacting, we usually talk about it a little bit like it's the bucket is full. So we need to
Mhm.
just start emptying the bucket. However, a lot of people with severe mast cell, we can't even get them to detoxify yet because their mast cells. One patient, I said, your immune system is like the Blues Brothers. It does not want to let anything in. So we would try to put her on one supplement. No, no, there didn't matter. Her body was just like, "Oh, you're not coming near me." And that's what it's like. So we actually have to stabilize the mast cells before we can treat the mold. Otherwise, people are just gonna cascade and get worse. I oftentimes refer to it as a bit of a crutch, giving mast cell stabilizers, but it's a really important crutch because it allows us to help that patient detoxify, to help the nervous system calm down, and then for that patient to be able to turn around and get better and not be in that super hyperreactive state.
This
Yeah.
is a real tangential, probably crazy question, but I'm curious, like, if you've had mold exposure or let's say a food allergy or an environmental allergy, and you get it under control, and then you get your mast cells under control. Let's say you're out walking in that leafy environment and you get a mycotoxin. Does that start the train running all over again? Is it something that we have to continually monitor? Because it just seems like there's so many environmental issues we have no control over. I just going for a walk and, you know.
Exactly. Yeah, that's a great question. So typically what happens with patients is when they come in, they don't have a lot of interoceptive awareness, and that is like your inner nervous system awareness. And they don't have that awareness because they're so inflamed. But once you start helping them to detoxify and get rid of some of these environmental toxins, they have a much better idea of where their nervous system is and how much they can handle. So, oftentimes, one of the questions we ask is, do you have trouble walking down the detergent aisle, like at your local grocery store? So, a lot of patients might notice that and they'll say, okay, once we start detoxifying you or getting everything out, you'll start noticing that you'll be able to tolerate or handle more things. I do think, however, that mast cells, interestingly, are a part of the immune system that remembers.
Mm.
There is always some memory of that, and that the mast cells keep that in their little checkbox, that if there's too much of it, they're going to react again. Or they're just going to give a little gentle nudge, like, hey, this is that stuff that we don't like. You better get out of here. So I find that most of my patients who have had like really severe environmental illness do always have some level of sensitivity after that sort of first like falling apart and then going through detox with me or another mold literate doctor.
It's so funny that you brought up that I can never pronounce it. It's interoception because I love that blog post too. I was like, yes. So I'm encouraging people to read your blog posts because they're always so interesting and profound. And for
Thanks.
me, it brings up more questions. And since you brought up that word, the understanding of our nervous system and being aware what's going on with us inside, I'm curious about this idea of do past traumas play into this as well? An emotional or a spiritual or physical trauma, at least maybe initially, a shock to the system, a loss. The pandemic to me was traumatic. Can that activate our mast cells as well? Or is it typically a mycotoxin or a virus or a shock to the physical system?
Our body responds the exact same way, whether it's mental emotional shock or an environmental exposure or a disease state, an infection of some sort. So our nervous system takes note of that. And it is interesting because what I've loved about being a doctor for the last 20 years is taking all these cases. I love people's histories. And so many of the histories, what you realize, start with some sort of mental emotional shock to the system. And then it's interesting because then the body will tend to pile on different illnesses in that very same area where we might be finding it in the system, or infections will find places there. That's why a lot of the doctors who treat Lyme disease say chronic Lyme disease is something that the Lyme bugs will go to different areas of the body, which is why it's nobody can figure out again for that, like what that is. So some people, Lyme infections will affect more their heart. Some people, it will affect more their gastrointestinal system. Some people, it will more affect their neurological system. So these, I think, are all areas where we probably initially had some sort of shock, and our cells on a very deep level were never able to recover, and our autonomic nervous system was still in shock and not able to work quite as well after that. It's something that's medicine is so fascinating because it's really multi-layered. And I think really the astute, good physicians are the ones that try to look through all the layers so that we don't get re-injured in the same place or keep having the same problem with our heart or things like that. It's always going to be more than the physical.
Wow, that's so fascinating to me. I just had a discussion recently about concussion. It was fascinating to me because the discussion that we had was about even then, just a little bump, not something to cause a concussion with the great big bold letters, but just a little tiny, you tap your head on the cupboard will cause the body to react as if you had a major concussion. Is that a similar correlation to that idea?
I've had some patients very severely injured just by knocking their head into a freezer door or a cabinet door, like you said, and they didn't have a concussion and they had a big bump and bruise, but the brain is bruised. You don't have to get a really huge injury to the head for things to be much larger than they seem.
And it
So
almost feels like we need to remember our history about something that I thought was, put in air quotes, cured, but now maybe that's the mast cells are just more on guard in that location?
it could be. So the other thing that's really interesting about mast cells and when people have mast cell activation is they notice that they call in recruits. So if there's an area in your body that what I think is probably more okay, you've had an injury or there's a mental emotional trauma or there's an environmental piece to it or there's an infection there, the mast cells will be like, "Hey guys, come on over here." And so all the new mast cells that are being born will actually go to that neighborhood in your body and hang out and help be bodyguards for that area. So we do know that there's an increase in mast cells. They've done biopsies on different places in the body where they know there's this like one good example is something called They call it eosinophilic esophagitis, which is where people actually feel like they cannot, their throat starts closing up and they feel like they can't swallow food without feeling like they're going to choke. And the gastroenterologists, they've done biopsies where they've seen more eosinophils, but the ones that have actually done biopsies and looked for mast cells also find an increase in mast cells in that area. So we know we treat that really similarly as other mast cell activation syndromes.
Oh, wow. I find it fascinating, but I also feel like this gets more complicated by the minute as far as being able to understand and diagnose it. When you are treating it and you've calmed your system down, shall I say, is it something that we can have to continue to work at calming down, or do we get to a stabilized point and say, "Okay, this is good here"?
So that is another great question. So far, what I feel like I've seen in my patient population is the patients who have more environmental illness, they in some ways can be like show up being the most severe, but also once they're able to get that out of their body, if they're able to get rid of mold or other like chemicals, plastics, things like that, once they're able to detoxify, they don't need to be on mast cell support anymore after a while. And the mast cell support is really just to help to be able to get them on these other things, to be able to pull the stuff out of their system. So patients who have more chronic infections, infections never really go away. We have exposures to viruses and spirochetes and all sorts of things, and they never really go away. We just need to help get our immune system back on board so that our immune system is stronger than and are able to keep all these infections at bay. And once that happens, I have seen where people have definitely been able to get off of cell stabilizers or just know like when they need to take them. And then the patient population where I feel like it's probably going to be more of a lifelong thing and not necessarily having to do it every day. I'm really into pulsing things, especially just only taking things when we need it or when we feel we need it, especially once our interoceptive nervous system is on board and we know when we're starting to get out of balance. So the hypermobile and the EDS population, those are patients who just have a little bit more, for whatever reason, of a genetic propensity for having mast cell activation syndrome. I think a lot of it probably has to do with the connective tissue. A lot of it probably has to do with, we do think that patients in those populations tend to be more susceptible to illnesses and infections, again, probably because of the connective tissue and the inability of the body to be able to really present a strong force. We know that things like chronic Lyme and spirochetal infections they just hang out in the connective tissue. And if there's weak connective tissue, they're going to be able to spread really quickly. So those are, I don't want to not give anybody hope. It doesn't necessarily mean that you're not going to get better. But if you have more of this genetic propensity, that is, like I said, where I've seen, we really just want to be more careful and have people really get to know their own body and know, okay, I know I'm starting to feel like I'm getting out of balance a little bit. And so I need to get back on my mast cell support.
I think one of the points I wanna put a highlight on what that you just said is getting to know our body better. Oftentimes, when some of the thrivers I've talked to go through this period of, "It just hurts so bad, I don't even wanna think about my body," or they running away from that issue of, "Oh my goodness, I have to really look deep inside and be aware of it." I know that's one of the things you talk a lot, and this is tangential, but do you have any tips for the starting person to say, "Oh my goodness, you're right, I should check in with the different body systems more often"? Do you have any tips for people to be able to just, "Okay, check in"?
I think it's really hard when you're in a flare state. Uh, it's natural for us, if we're having like a mental emotional trauma, oftentimes we learn to disassociate and leave our body because that's really, especially when we're kids, we can't run away from different things. And when we're in chronic pain or a lot of inflammation, I think we do the same thing. So it's not something that I would expect somebody to be able to know how to do or to be able to do right away when they're in that sort of bad flare pain or flare mast cell state. But as they get better, I do think that is an important part of our wellness. A lot of my Ehlers-Danlos patients and hypermobile patients, I tell them there's not a lot medically we can really do, but what they can do is they have to learn more about their proprioceptive system. Like I send them to PTs here in the Portland, Oregon area who specialize in treating hypermobility. And a lot of it is actually just connecting in with their nervous system and strengthening their muscles and their ligaments so that so that their connective tissue is not going to continue to fall apart. And that's not just something that you do in a mindless way. You have to be connected in with that autonomic nervous system and continually communicating with it. And same thing like with environmental illness or patients who have a chronic viral illness or chronic Lyme, things like that. These are patients that they can't really get there until they start getting some of these products out of their system. Like the mycotoxins need to get out of their system. Or we need to do some killing strategies for Lyme or mycoplasma or viral illnesses to be able to help get their immune system back on board. So it'll just take a little bit of time. And then after that, that's when we look at again a lot of those sort of brain retraining programs, doing gentle exercises. I love having people do either cranial sacral therapy or do neural injection therapy is one of the therapies that I do that kind of helps reset the nervous system. Acupuncture, these are also all things that are very helpful for helping to reset and get our nervous system back on board and help us to connect in. And then really lastly, it's not it's not for everybody. Some people are like, "No, I'm not probably never gonna do that." But if you are drawn to doing mindfulness type meditation techniques, there's a lot of things about that really what that's doing is that's you listening to your own body. So and you don't have to, like, become a Zen master or anything like that. There's a lot of, like, really cool books out now that just have very short, "Hey, here's a little mindfulness exercise that you can do for 10 minutes every day." Or doing breathing exercises. One of my favorite things is in Portland, we're in a pretty small town, so we don't do a lot of my patients don't do a ton of commuting, which is great. But a lot of my patients who had to commute, I would say, do your breathing exercises when you're commuting because it's time that you are not doing anything else. You're just, you can breathe while you're driving and just be mindful of your breath. And then you might not get really aggravated at the person who's driving like a dork beside you, you know? There's a benefits to that.
Oh, wow. I just love spending time with you, Dr. Ann. Now, we're just about out of time. Share any final thoughts that you would love to share, and then also how people can get a hold of you on your wonderful newsletter.
I am at just my name, which is www.drannhill, and it's Ann spelled with an E and doctor all spelled out.com. And I think what I'd love to have people know though is how can you find somebody who is more mast cell literate? And especially for if you have any listeners that are not in the Portland, Oregon area or trying to find somebody in their area.
We
A
have
lot.
people international, so some tips
Oh,
on the questions to ask or something would be
yeah.
awesome.
Okay, so at least in the US, I know like there are a lot of functional medicine doctors and a lot of doctors who are treating environmental medicine. Myself as a naturopathic physician, not all naturopaths understand this or treat this. That's my goal is to do more training of naturopaths so that we understand how to this in our practices. But really, I think doctors who are literate in Lyme disease, doctors who are naturopaths or functional medicine doctors, doctors who treat environmental illness, especially mold illness, because I think in the mold illness community, like the doctors who are treating that, they're really starting to connect the dots and notice, oh, yeah, there's these really sick people coming to us that have mold that we have to figure out other ways to help them. So in the US, I'm not sure if they have an international component, but there's an organization that I belong to called the ISEAI, and it's the International Society for Environmentally Acquired Illness, and you can find practitioners there. I know over in Europe there are also Lyme disease literate doctors. We have Lyme literate doctors here in the US, so you can look that up. I actually don't know. I think you just look up ILADS and it's like I'm really bad at acronyms and remembering acronyms, but it's like the International Lyme Disease Association Society or something like that. And they hold conferences every year. And I know it's an international crowd. So I know that there's doctors from all over. So those would be the two first places I would start. ILADS, like I said, is probably international, or there might be like another one that's over in the Europe area. So not everybody who is Lyme literate is going to know how to treat mast cell, but they're probably more likely because they are going to be being exposed to more patients who probably have this.
And we'll have those acronyms up on understandingautoimmune.com because that's not my strong suit either.
Yes.
I have to write them out. Oh, that's the acronym. Okay, that's good. So, everyone, that's Dr. Ann Hill. Thank you so much, Ann, for being on the show and explaining this to us because I think it's often overlooked and one of those, as I like to say, invisible illnesses that are often just said, it's all in your head, which isn't fair. That's not fair to gaslight people when they have real issues. Everyone, have a great week. Whatever your adventures, join me next week for another brand new episode. Enjoy.
The information provided on the Autoimmune Hour, Understanding Autoimmune, and Life Interrupted Radio, including the websites understandingautoimmune.com and lifeinterruptedradio.com, plus social media, is for educational purposes only. What you read, hear, and see on the Autoimmune Hour, Understanding Autoimmune, and Life Interrupted Radio, and its websites, and other media outlets is based on experience only. The information should never be used for any legal, diagnostic, or treatment purposes.